Welcome to another episode of I Can Do This. I got this. This is Anatomy Review. Today I'm going to talk about the respiratory system. Two ways to say it. Respiratory or respiratory. They're both just how you use these words. The respiratory system is the system that is going to, one, bring in our oxygen, and two, it's going to help eliminate our carbon dioxide. It also helps regulate our pH in our blood. So anyway, let's talk about the anatomical areas. We have to ventilate, that means moving air in and out. And then we're also going to have to think about respiration or gas exchange. First part, the primary area of bringing air in through our nostrils, we call them external nares, and these external nares open to what is our nasal cavity. The nasal cavity is actually this region where we have other structures inside. The medial aspect of each side is separated by what's called the nasal septum, but we also have these bones, the ethmoid bone and the vomer and inferior nasal concha, that create this septum and region of swirling effects. We call it the nasal concha, superior, middle, and inferior nasal concha. The nasal concha are going to help us swirl, kind of that turbine effect, moisten and humidify the air that we breathe. The nasal, basically the nasal passageway, this system is lined by the mucous membrane. That mucous membrane having mucins, just kind of the mucus formed. This is to help us moisten these passageways. But this region helps really humidify the air. The opening in the posterior nasal cavity, the internal nares or conae in the bone, this is that opening into the nasal pharynx. This nasal pharynx is that region that, if you look back to the back of your throat, you're going to see the uvula, that little punching bag looking thing in the back. That is the part of this soft palate that actually will help seal off the nasal cavity when we are swallowing a bolus of food. So that region in behind there is called the nasopharynx, and that nasopharynx also has openings from your middle ear, eustachian tube or auditory tube, that empties into those regions. That's why when sometime you yawn, you might have your ears might equalize or pop. It's just the equalization of your pressures in the middle ear to the outside air through the external ear canal. So that nasal pharynx opens into the oral pharynx, and then air needs to go into our windpipe. Well, let's learn about these structures now. The opening leading to what's called the larynx, that's the old term we used to call it the voice box. This is going to open the laryngeal pharynx, and we have an epiglottis that is going to be the movement with this basically elastic cartilage Excuse me. Oh, I was exercising my epiglottis. That's epiglottis. You couldn't beatbox without it. Or cough. It helps us. But its primary role when we are swallowing that bolus is we have to seal off the glottis, or the opening, the airway opening into the larynx. Air is going to go into the larynx. It's going to pass through the glottis, which is the opening between our vestibular and true vocal folds. The vestibular fold, which is our false vocal fold, is the superior one. It overlies the true vocal fold, where in the medial aspect of it is where your vocal ligament is. It is like a V pointed towards the front, open in the back. Epiglottis closes from the front towards the back. The esophagus is posterior of the larynx and trachea. Air flows through this glottis into the windpipe, which now we learn it as trachea. Now, these cartilages that help support the larynx, a large area, this Adam's apple region right here, this one right here, this cartilage is called the thyroid cartilage. The ring that is just inferior to this large ring, is known as the cricoid cartilage. Now, the cricoid cartilage is kind of like this. It's a circular opening in the front, and it's kind of in the back like this, posterior, and more supportive. And this, with the thyroid cartilage, helps create this opening or supportive airway opening to the trachea. It also supports with the retinoid cartilage, helping to manipulate our vocal cords. Vocal cords. A higher pitch is a more tension on our, just like wind strings, string instrument. More tension, higher pitch, lower tension, lower pitch. Air empties into this, or goes into our trachea. Now, the tracheal rings and all the other cartilages of the larynx, excluding epiglottis, is formed by hyaline cartilage. So it's more of this little supportive cartilage. Now, it is an incomplete ring that is open towards the posterior, so this helps keep our airway open. But in the posterior, it's open to allow where our esophagus is. So when we have this swallowing of food, we're going to have this potential space that actually can swell open a little bit and not be hindered by the rings of cartilages. So that's why in the posterior it's open, to allow the ease of swallowing the bolus from down the esophagus towards the stomach. One sec. Now, as air goes down our trachea, it's going to go into our thoracic cavity around this mediastinum region, and it's going to have a bifurcation. That bifurcation and this cartilage region that literally goes around the opening of that bifurcation is called the carina, or carina, which means the keel, like keel of a ship. So it helps support that bifurcation. We have two lungs, left lung and a right lung. So this first bifurcation is called primary bronchus. So we have one on the left, one on the right. Now, the left side is a little more horizontal. The right side slightly steeper. Now, in the lungs themselves, we have this orientation of lobes that separate out this larger areas of the lung. So on the right lung, we have 3 lobes, and on the left lung, we have 2 lobes. The way I remember it, and hopefully this will help you, is I take my right finger, touch my right side, and I draw a capital R, and it takes 1, 2, 3 strokes for a capital R, 3. So the right lung has 3 lobes. I take the left finger, touch left side, and I draw a capital L, and this is what creates a 2-stroke motion, so I think about 2. Left lung has 2 lobes. This also works for our atrioventricular valve between atrium and ventricle. We have 3 on the right, 2 on the left. These are the number of cusps. So we have a tricuspid valve on the right and a bicuspid on the left. Now the bicuspid, another name of that is the mitral valve due to the 2-flap fold. Looks like a bishop's hat called a mitre. That's where they came up with the name. But try right, buy left. Try it before you buy it. Anyway, just a way to help you remember. But anyway, back to the lungs. So, as we bifurcate the trachea into the left and right primary bronchus, on the right side, the secondary bronchus has 3 branches. This is also known as the lobar bronchi. On the left, it bifurcates into the 2 lobes on the left. So we have on the left side the secondary bronchus. This is our left lobar bronchus. The next order, the tertiary, third order, tertiary is how it's spelled, but tertiary bronchus is another branching into the different segments. Like there's different, maybe roughly 9 or 10 on the right, and roughly 9 on the left. There's slight variances depending on which resource you use. So depending on the level you're learning, you might have to go into your resources and find their individual names. But this third order is called the tertiary bronchus. Now the tertiary bronchus is the segmental bronchi. Now segmental bronchi are going to branch again, and a huge volume of branching into what's known as the bronchioles. Now the bronchioles at this point no longer have the little fragments of hyaline cartilage that keep the airway open. Its main purpose is because of the smooth muscle within it, it helps regulate the airflow through our autonomic nervous system to help regulate the kind of air movement within these regions of our lungs. Now, the bronchioles are going to then further divide to these terminal regions, we call them terminal bronchioles, that end to what's known as the respiratory bronchioles. The respiratory bronchioles literally end in these cluster air sac filled regions known as lobules. Now, a lobule is basically kind of like a bouquet of balloons. These bouquet of balloons are totally open, and this bouquet of balloons is literally, if you think about like a bouquet of balloons, and where they would touch, imagine they're glued together, and where they press open, they create these open cavities from one to another, kind of like this. Well, that creates this huge surface area for us. Now, those individual areas are known as alveoli. Now, at this level, we're looking at a simple squamous epithelium that literally is lining internal openings where gas exchange is occurring. Now, on the outside of those alveoli, we have this huge cluster of capillary beds. This is the capillary beds from the right side pump of the heart. Right ventricle pushes up, remember, pulmonary trunk, pulmonary arteries, and through the pulmonary arteries down into the lung. It's bringing in pictures. It will be blue because it's deoxygenated blood, and it's going to flow into those capillary beds for gas exchange. And then it's going to change a more bright color because the oxygen coming in. So in a sense, in diagrams, they use the red color to represent oxygenated blood coming back. Now, veins draining back, because arteries away from the heart, veins are draining back. See veins coming back. The pulmonary venous side, on the venous side of those capillary beds, bringing that oxygen-rich blood back to the heart. These are veins that are really bright red. So that's kind of the region from pulmonary ventilation, is basically bringing that air all the way to the respiratory zone, which is the respiratory bronchiole, the lobules, which have our alveoli, little air sacs, and ventilation's up to that point in time. Now, the diaphragm muscle is a primary muscle for breathing. This would be inspiration, and so when it contracts, it's like a dome. It flattens out, creates that negative pressure. Air pulls in higher atmospheric pressure than our inner pleural space, so that brings air in. Just the rebound, the relaxation of that muscle, the elastic fibers in nature, that's how we just, in apnea or quiet breathing, we're able to breathe out. Now, forceful breathing, forceful inhalation, external intercostal muscles, and other muscles, scalene, things like around your trapezius, anything to raise up the shoulders for forceful inhalation. This is going to help. Now, forceful exhalation, internal intercostal muscles, compression of the abdominal muscles, rectus abdominis, external, internal, oblique, transverse abdominis, pressing the abdominal cavity, pushing up on the diaphragm, helping move air out. So that's dealing with some of that movement. Primary nerve that operates the diaphragm is the phrenic nerve. The phrenic nerve is actually from our cervical plexus, which is C1 through C5. It is C3, C4, C5. Keep your diaphragm alive. So that is the phrenic nerve. and that comes down between the lungs and the heart, down that mediastinum towards our diaphragm. That is just kind of a, well, oh, one other thing. Inside the bronchi and trachea, what help keep the airway clear, because the mucous membranes, it traps air particles, so we have what's called the Pseudo stratified ciliated columnar epithelium, like a little up escalator. So the mucus moving up like this, well, the air particles are trapped in there, and that's where it goes up to the pharynx. And every so often we find ourselves just swallowing. Well, that's just keeping our airway clear and clean. The amount of mucus you actually swallow is quite amazing. Almost 2 liters a day. But that's just normal physiology. The cells inside the alveoli, the type 1 pneumocytic, or sometimes referred to as pneumotaxic cells. These are just a simple squamous epithelium where gas exchange occurs. The type 2, also surfactant secreting cell. This is the septal cells. That's what produces surfactant, which just keeps the low amount of, because a small space with water, the film of moisture there, it has what do they call hydrogen bonding, so there's like a water tension, so it will try to collapse the airway, the little alveoli sacs. So we have, just like when you put dishwashing soap on water, it breaks the water surface tension. Well, the septal cells, it's not detergent, but it's just designed to help release the effects of the hydrogen bonding so we don't go into respiratory distress. That's why sometimes a newborn infant that might have to aspirate, that happened to aspirate some of the amniotic fluid, might have to get a spray of some of that surfactant to help their airway open up so they're not under the respiratory distress. Anyway, this concludes another review of the respiratory system. This little podcast is brought to you by sheerimpact.com.